Hi, class. Over the past 5 weeks, we have familiarized ourselves with ethics and its role within healthcare. From an early age, we are taught the building blocks of ethical behavior, which can include kindness, honesty, compassion, etc. Ethics is not always cut and dry, however, especially in healthcare. Healthcare presents many challenges and tough decisions. This is why healthcare professionals generally lean on ethical committees within their establishments to review questionable situations. Nurses are often faced with ethical dilemmas. The following paragraphs will detail a scenario involving an ethical problem between a patient and nurse, the ethical and legal implications, the patient's rights, if workers' compensation is available to the nurse, and how the nurse should have handled the situation. The scenario is as follows. An Alzheimer's patient strikes you in the face and breaks your nose. You strike back to defend yourself, and you injure the patient. Both ethically and legally speaking, the nurse's response to this situation is unacceptable. According to our legal and ethical issues for health professionals textbook, healthcare professionals are to follow medical ethics, utilizing the principles of autonomy, justice, beneficence, and non-maleficence. In the above scenario, the nurse responded aggressively towards the patient and disregarded the principle of non-maleficence, which is the rule of do no harm. The patient was not in a clear mind when the incident occurred. However, the nurse was fully aware of the situation and deliberately attacked the patient. By responding violently to the situation, the nurse has opened themselves up to disciplinary action from their workplace and legal action by the patient and/or family. From our legal and ethical issues for health professionals textbook, it could be argued that the nurse engaged in an intentional tort or wrongful act that placed the patient in harm's way. The nurse could face legal implications for assault and battery by causing the patient fear and physically harming them. As noted within the aforementioned scenario, the nurse was injured by a patient during her shift. This generally means the nurse would be eligible for workers' compensation. According to our legal and ethical issues for health professionals textbook, workers' compensation is a form of insurance made available to employees that are injured on the job. Because of the workers' injuries, workers' compensation covers acquired medical costs and loss of wages during a worker's time off. However, there are certain criteria workers must meet in order to be eligible for such coverage. In this particular situation, I do not believe the nurse would be eligible for workers' compensation due to the fact she retaliated violently against her patient. By breaking the code of ethics and hospital policy, this nurse may lose her job because of her poor decision. There are zero-tolerance policies regarding workplace violence, and nurses should not accept that violence against medical staff is part of the job. On the other hand, patients have rights that are meant to keep them safe. According to an article within the Journal of Medical Ethics and History of Medicine, these rights include the right to privacy, respectful care, the right to participate in their own medical decisions, the right to efficient care, and the right to a complaints department. Unfortunately, the scenario addressed in today's discussion is just one of the real-life situations healthcare professionals have and will continue to face. However, this particular situation could have been handled in a more ethically sound manner. Rather than retaliating against the patient, the nurse should have immediately called for assistance and removed herself from the situation. The nurse's supervisor should have been contacted for support during this time, and the nurse should have been sent to the emergency department for medical treatment. As soon as possible, the nurse should have filed a complaint so workers' compensation could have been on the table for her. As mentioned, these situations do occur and can happen to anyone, which is why every nurse should know their rights and the rights of their patients. Thank you.